Specimen collection and preservation. Samples collected from living subject. Blood, most common sample, 5 ml of venous blood is collected in a purple container, vacuum container, EDTA tube and mixed thoroughly without shaking. Heparin is not used as an anticoagulant since it interferes with the PCR. Sample can be preserved at 2 to 8 degrees Celsius, not frozen. Buccal epithelial cells. Buccal swabs are considered as a convenient alternative for collecting genetic material as they are relatively easy to collect, inexpensive and non-invasive. Swab is removed from the packing and without handling the tip immediately swabbed the mouth subject for 10 seconds. After swabbing it placed directly into receptacle package to dry. Hair follicles with root plucked hair about 10 to 20 from the head is used as a reference standard. The root of the hair contains nuclear DNA and the shaft contains mitochondrial DNA. The root contains keratinocytes which are ideal for the extraction of nuclear DNA. Cut or naturally shed hair without follicle may not entirely be helpful since some nucleated corneocytes, keratinocytes in their last stage of differentiation are present which make it possible to extract a DNA profile. Sources of DNA. Primary tissues, blood, soft tissue, bone tissue, teeth, soft tissue, blood, brain, spleen, muscle, skeletal muscle, cardiac tissue. Samples collected from dead bodies is this. DNA can be isolated and tested from practically any post-mortem tissue, although after death it will undergo progressive degradation. DNA is broken down into fragments by autolytic and bacterial enzymes, especially DNases. In a relatively fresh dead body is unclotted 10 ml of blood. EDTA anticoagulated in a sterile tube is preferred the source of DNA. Buffers, those containing EDTA are designed to inhibit the activity of nuclease that can break down DNA. Due to settling out of a WBC, the clotted blood is not a good source of DNA. Brain tissue is a good source of DNA in an intermediate postmortem interval. Hard tissue, bone and vascular pulp of tissue is the best source of DNA in cases of advanced decomposition. Best material is said to be the muscles or spleen. If decomposition is establishing, bone marrow from femur and these usually molars are also recommended. Postmortem material is inferior to live blood and tissue for DNA testing. Any disturbance to nuclear chromatin due to putrefaction is dangerous. Samples encountered in forensic practice: blood, EDTA, heparinized clotted stain on cloth, newspaper, wood or tiles, semen stain on cold cloth, paper, floor, hair, dye, body, pubic tissue, bone marrow, muscle, spleen, fingernail scraping, mouth swab and saliva stain on cigarette butts and liquid envelope and glass. Thank you.